Hi, everybody. Welcome to the winning ceremony for GLackathon 2021. We're really happy that you all could be here. I did want to let you all know that in reviewing all the submissions, we were very impressed across the board at how you guys brought these solutions together. I know we gave you a great problem statement with a nebulous way to fix it. And you guys really came to the table. The level of creativity was all across the board. It was clear to see. I think you should thank your educators. You did them proud. I saw organized problem discovery methodologies, gap analysis, a real flair for marketing and communication, which I did not expect, if I can be honest. I thought this was going to be code heavy and very technical, and you guys proved me wrong, so we're impressed. Thank you for your time. I know it was a heavier lift for my team than we thought it was going to be. I can't imagine what the work effort was like for you. So thank you for sticking with it and submitting, all of you. We had a hypothesis when we did this, and maybe it was naive. It was, could we bring together industry, technology partners, and citizenry to solve a real problem that's happening out there that's acute for everyone? And I think the lesson we learned was we can, that we could do this over again and solve a real problem. We got some lessons out of this, and one of them was to enable you all to better deliver a real solution and really help. We have to give you access to systems and data, and we didn't do that this time at all. So what you were able to do with that gap was pretty amazing. So we will do this again. I think you've taught us that it's possible. I think we can solve real problems that we all have. With the technologies at our fingertips. So congratulations. Before we get into sort of the meat of the presentation, I won't take too long. I did want to thank a few people just from an organizing committee perspective. Angie, Melanie, Lester, Jimmy, Brian, Angeli from Greenlight for getting all sort of the work done. Diana from UiPath for helping us sort of structure this a little more appropriately. And then from the UHN side, you're going to meet Michael, but Teresa, Wilson, Simranjot for making sure we got a real problem statement to deliver. So thank you all.
So from University Health Network, we have Michael Caesar, the Executive Director of Data and Implementation Science at University Health Network, and Adjunct Faculty in Health Policy Management at the University of Toronto. Over the last 20 years, he has served in several healthcare leadership roles, focusing on complex clinical change management, business transformation, and clinical process improvement. Michael and his team have been awarded several international awards for quality improvement and change management. He earned his MBA from the University of Victoria and holds both PMP and PFMP certifications from the Project Management Institute. Thanks, Michael. From SickKids, we have Nimira Dhalwani, who leads the infrastructure and integration portfolio at the Hospital for Sick Children, where she has the organizational responsibility for IT operations. She also leads the operations of the Provincial Pediatric Electronic Health Record, UHN. Nimira has over 15 years of experience in the delivery and operations of large-scale complex health system integration and transformation initiatives. Welcome, Nimira. From UFT, we have Paul Grease, a graduate of Cornell University with a degree in computer science. He began his career 22 years ago with the University of Toronto's Faculty of Computer Science. His many distinctions include Associate Chair of the Undergraduate Computer Science Program, founder of DSEL, which is the Department of Computer Science Innovation Lab at UFT, and is the co-author of Practical Programming. Welcome, Paul. From UiPath, we have Sean Hinton, Vice President and General Manager of UiPath Canada. Sean has held several executive leadership roles in enterprise organizations like Bell Canada and BMC Software. He holds a degree in industrial engineering from Ryerson University and a master's certification for project management from the George Washington University. Welcome, Sean. From UiPath, we also have Nafis Kashwani, a graduate of University of Regina with a master's degree in computer science. He has 7 years of pre-sales engineering experience and is currently a technical account manager with our key sponsor, UiPath. Welcome, Nafis. And from the Greenlight team, we have Lester Mendoza, RPA manager, Melanie Lamb, senior RPA business analyst, and of course, Shameiz Hemani, our fearless leader.
I did want to take a bit of time just to thank everybody as well. I know we just went through thank yous, but I'm going to do it anyway. So I think UHN had the opportunity to put a case study and a problem on the table, and really appreciate all of the contribution, all the efforts, and time that went into bringing it together and bringing some great solutions on the table. So Shameiz and your team, thank you so much for providing this as an opportunity for us. And UiPath, Sean and Graham and everybody from UI, we know the tool is great and is able to solve some great problems, and I think we were able to prove that through this work. The team at UHN, I think I saw Wilson on the line, but Maylin and Teresa, and our clinical partners who are so critically important to help us understand the clinical processes and the challenges that they face every single day. And really all of you, the participants, the students, the faculty advisors that were brought together to spend your time on this work. So really appreciate that, and I appreciate we're going to say a lot of thank yous, but I just wanted to get that out there. And at UHN, I know probably many of you did some research and saw what UHN's about, but this particular problem, when we think about coming into clinic at the various hospitals that we have, we see 1 million patients a year coming into clinic. And from my perspective, that's 1 million opportunities to improve and 1 million times that we can do things better. And so we really appreciate this and the time that you've spent on working on this. And that's really the order of magnitude. And we're one of many hospitals in the GTA and one of many hospitals across Canada. So it's a hugely impactful thing. And through COVID, we've experienced a shift. There's a lot of people who aren't coming into hospital and people who are doing virtual. And it's shifting the way we interact. And we're spending a lot of time at UHN thinking about what that future looks like. And this work is a major input to that and helps us think through how do we automate, how do we bring new capabilities and processes to the table that allow us to interact with our patients and really ease their ability to connect with the care providers that they need to connect with. And we know that it's not only about the patients, although they are the most important part, it's also about the providers. And in the solutions that we reviewed, many of you thought about the patient processes and wanted to make sure that the processes were involved to make sure patients were taken care of, communicated to, they knew where they were, but more importantly, the providers are part of that process. And we need to make sure we're looking at both sides of the coin to make it easier for everybody with a patient focus at mind. We know humans will always be involved. We know that there's complexities of legacy systems. I know many of you dealt with the whiteboards and some of you reinvented the whiteboard for us. Thank you very much. And we also know that there's tension between past processes, old processes, and the desire to create new processes. So thoroughly impressed with everybody who took a stab at bringing a solution to the table. And I know I've gone on longer than folks expected, but wanted to just talk about that because I know many of you spent some time in proximity to UHN thinking about us as an organization, thinking about our patients, and really appreciate that and really appreciate this opportunity for you to come and join us in some of the challenges that we have. So without further delaying this session, I wanted to congratulate Six Health. And they were really able to wrap up all of these complexities that I just went through together in a really nice, clean solution. So really impressed with their solution that they brought to the table.
Welcome to Six Health's video solution for GLackathon 2021. Let's meet the team. We wanted to combine our expertise with RPA to address the problem of tedious check-in and wait time processes at UHN ambulatory clinics. Introducing SickBot, our bot that will make your life easier. Our solution focuses on helping patients skip a lengthy check-in process by utilizing our effortless check-in via RPA-implemented program on an iPad. Once the patient has scanned their card and completed any necessary forms on the iPad, the bot will process their information into the EPR right away. Once the patient has scanned their card, their arrival status is updated on the whiteboard by the bot. A unique feature to our RPA integrated check-in application is patients have the option of registering for SMS updates regarding their wait time. The bot will generate these SMS updates every 15 minutes by using the information from the whiteboard. Once the patient has completed the check-in process on the iPad, the bot will calculate the estimated wait time using the information on the whiteboard and display it to the patient. It will also update the patient's wait time on the whiteboard as well. Once the patient has completed their visit, the physician will close their file in the EPR. This will trigger the bot to update the patient's status on the whiteboard and remove them from it. SickBot, the solution UHN needs. Thank you for watching.
It's been really fun to organize this hackathon with Greenlight Consulting. I've done many hackathons in my time, so this one is definitely a stick out for me, and really cool to see how much excitement there has been around this, especially in a targeted hackathon for healthcare solutions. So this team got the top overall solution, and I know they said they were surprised on the last win, but Six Health does win again for top overall solution. So congrats to Six Health. It is definitely a badge of honor to win multiple titles, so big congrats to all.
Great, thank you so much. And it was a pleasure to be looking at all these innovative solutions and to be able to announce today that the winning team for the most innovative solution is Team JARS.
So we did a last minute award because I'm always a believer that there's someone hanging around in the solution space that we wish could have won, but hadn't. So we did an honorable mention award. The winner for honorable mention, and we got to find a better name for that next time, is Parth. I think what we thought was really cool was, the ideas of using the health card OCR. There's some neat uses from text to speech, which we thought were great, and the effort to sort of create the simulated data stores.
Already? We're done?
Yeah.
Wow.
All the fun
Well,
wrapping up.
the exciting part, for us at UiPath, one of the reasons why we have this concept of an academic alliance is to give students and education organizations the ability to use this to find good, to learn the technology, to go out there and figure out creative approaches. Shameiz, you and the team did a great job bringing everybody together. It was your idea. You guys pulled this together, and it's a great application of bringing education and industry together to do something interesting. So Great event. Really happy to be part of it. There was over, I think, Shameiz, there was over 20 plus teams that put in a ton of time and effort. So first off, I want to thank you all for doing that, because without you guys participating, this would have been an absolute waste of time for everybody else on the call. So number one, thank you there. The folks from U of T and George Brown, again, you guys supporting this initiative is critical, and supporting both Greenlight and UiPath to kind of make this happen is important. And then you've got all the support from both of us if you ever need it. So thank you for being involved. And UHN and SickKids, if you didn't let us invade, or this team invade, so to speak, to try to let 20 teams take a stab at solving your business problems around the patient experience, I mean, again, this wouldn't have been real. So I wanted to say a big shout out to you guys for letting us be part of this, and letting 20 teams invade your environment to have some fun and come up with some creative solutions. So all in all, thanks, but a big shout out again to Shameiz, Thyagi, Angie, Lester, and the GL team for making this a reality. And with that, I think that's it, right, Thyagi?
I think that's a wrap.